formed when something is pressing against the skin, creating pressure and reducing blood flow to an area. Reduced blood flow causes the skin to die. This usually happens over bony areas in your body, like the heels of your feet, right above your buttocks, elbows, shoulder blades, and on the back of your head, though it can also happen in other places in your body. Pressure ulcers are classified as one of 4 stages. Stage 1 is when there is reddened area that does not turn white when you press down on it. Stage 2, on the other hand, is when there is skin loss involving the first and second layers of skin. Stage 3 is when there is more damage to the area involving not only the first 2 layers of skin, but also the fat lying underneath them. Finally, stage 4 is when there is even more damage and you can see all the way to your bone. Doctors also diagnose a pressure ulcer as unstageable, when the bed of the pressure ulcer is covered with dead black tissue and can be seen. Without being able to see the pressure ulcer's bed, the wound cannot be categorized into one of the 4 stages that I mentioned. The dead black skin has to be removed before it can be categorized.
Taking care of a pressure ulcer at home focuses on keeping pressure sores from getting worse and restoring healthy skin. Home care should include checking the skin daily for signs of sores and protecting vulnerable areas from pressure, friction, and moisture. Ask the healthcare provider how to clean, dress, and bandage the sores properly. Tell a doctor or nurse right away if you have signs of infection like a bad smell, increasing warmth, redness, or pain. Draining, pus, or yellowing at the base of the wound are also signs of infection. Find helpful products to relieve and treat pressure sores, but always ask your doctor first. Clean the pressure sore by rinsing the wound with a saltwater solution, which is available at your local drugstores, or other cleaning solution recommended by your healthcare provider. Pat the wound dry and apply a dressing to keep the pressure sore moist while keeping the area around it dry. Clean the skin with warm water and minimal friction. You can apply lotion often on the areas with no wounds. Avoid direct pressure to bony areas such as the ankles and the hips. You can use pillows and padded protectors to support the arms, legs, and bony areas. Changing position if bedbound every 2 hours. Move around carefully to avoid skin tears and scrapes. If bedbound or chairbound, you shouldn't sit with the head elevated for long periods of time. Check and change bed linens as often as necessary. Cushions themselves may actually become a source of pressure. You shouldn't massage bony areas of your body and especially not pressure ulcers. Do not use remedies such as iodine peroxide and/or cornstarch because they may further irritate your skin. And finally, help healing by watching what you eat. You can eat a balanced diet with extra protein like beans, whole wheats, and chicken.
The medical treatment of pressure ulcers depends on the condition of the ulcer. An ulcer must be cleansed to get rid of that tissue stops healing. Like any other wound, the pressure ulcer is at a risk for infection, and therefore antibiotics must be used to avoid infection. After the risk of infection has been eliminated, healing can start. Medications are used to help heal. Proteins are also needed to rebuild the tissue. Pre-albumin is a protein that helps and quicken the healing by transporting all the proteins to the wound. Pre-albumin is used because it leaves the body quickly after its action and has very few side effects. Vitamin C can be taken or eaten in diet in the form of oranges, kiwis, or strawberries. A diet rich in proteins is best for healing. After cleaning out the dead skin, the wound must be cleansed of any discharge and kept moist for the growth of new tissue. There are a number of things we can do to keep a wound clean and free of dead tissue. Special dressings are used to help heal the pressure ulcer. Some are made to absorb liquid and pus from the wound, and others use chemicals to eat away the dead tissue. Another kind of dressing has a sponge connected to a vacuum. The sponge is shaped and placed in the wound to absorb the fluid and the bacteria. The treatment significantly accelerates the healing.
There are several ways to prevent pressure ulcers. One way is to keep your blood flow healthy, and exercise is a great way to do this. Walking and swimming are best because they don't make your body's joints work so hard. Keeping your blood flow healthy also means that if you have to spend a lot of time on a chair, bed, or certain position, you have to shift your weight to avoid creating pressure on one area for a long time. In a chair, shift your weight from one side of your body to the other every 10 to 15 minutes. And in bed, take turns lying on your back, stomach,
left and right side every hour or hour and a half. If you can't turn when sitting or in bed, have someone help you. Put pillows under parts of your body to shift your weight and cushion bony areas. When standing for long periods of time, shift your weight from one foot to the other. A healthy and balanced diet, including protein, is another way to prevent pressure ulcers. Protein is found in meat, beans, eggs, and fish. Protein is used by the body for building new tissue and keeping your skin healthy.
Staying hydrated is necessary for the skin to stay healthy. Another way to prevent pressure ulcers is to keep the skin dry from sweat, urine, and stool. Carefully check the skin folds, such as areas under the breast, arms, and groin, and between the toes. The skin should always be cleansed with mild soap and water. It should also be soft, and a lotion can be used to prevent it from being dry. The linen should be cleaned regularly, and special attention should be given to any fold-in sheets, as well as other things in the bed which can cause pressure on the skin. Every morning and evening, remember to look and check potential pressure ulcer areas like the back of the head, the shoulder blades, the sacrum, the knee, and the heel. Don't massage any reddened areas or bony areas because it can damage the skin and tissue. Lastly, don't drag your weight and skin across any surface when changing positions because this causes friction on your skin.
Populations at risk for developing a pressure ulcer includes the bedridden or those confined to a wheelchair, the aging because of thinner skin, the incontinent, and the malnourished. Other populations that are also at risk are those who cannot move part of their body, like those who have a spine or a brain injury, people with conditions like diabetes or disease affecting circulation. Having a mental disability from conditions like Alzheimer's will increase their risk for pressure ulcers too. Now, let's talk about things to remember. Remember to look and check your skin daily. Eat a well-balanced diet with a good source of protein like meat or fish. Keep your skin clean and dry. Call your doctor immediately if you see any signs of infection in the wound. And remember to exercise regularly and change the position often, usually every 2 hours.